Seton Hall University, one of the nation's leading Catholic universities, has a long and rich history. Over 160 years of challenging students and preparing them for success. In small classes, students thrive and find countless opportunities and advantages. Seton Hall's main campus is located in South Orange, New Jersey, a quaint suburb just 14 miles from New York City. It's also just 12 miles from Seton Hall's Interprofessional Health Sciences campus. The campus is located at the crossroads of Nutley and Clifton, New Jersey, only about 25 minutes from New York City and Seton Hall's South Orange campus. The surrounding area boasts many restaurants and shops, including a Target, a movie theater, and supermarkets. The towns of Nutley and Clifton are lovely residential suburbs with many apartments and homes for rent. In addition, Franklin Avenue, a main street just blocks away from the IHS campus, is a great place for a stroll or to grab a bite to eat. The IHS campus offers all of the amenities and services students need. An information commons, which provides library resources and ample space for studying. Lounge areas and a cafe where you can relax, hang out with friends, and play games. A bookstore where you can pick up your pirate gear, and a chapel for peaceful reflection. The IHS campus offers cutting-edge classrooms. Our learning studios are highly advanced and enabled with technology. They create an interactive learning environment. Our learning environment fosters a more participatory model. Our simulation center is the heart of the IHS campus. This is where the three colleges come together to experience true interprofessional education. In this integrated environment, a group of students will be given a real-world scenario. For example, medical students, nursing students, and physician assistants could be in a simulation OR to remove an appendix. Each individual simulating the role they would play during an actual surgery. Meanwhile, in the control room, students will be presented with different challenges during the surgery. For example, the simulation mannequin can go into cardiac arrest during the surgery, or have a sudden drop in blood pressure. This allows students to learn to respond in real time to actual events and do so collaboratively within an interprofessional environment. This is all being filmed and broadcasted to groups of other students who are observing in the debrief rooms. After the simulation exercise, all students review the footage with their faculty, who use this as a valuable learning tool. Our simulation labs include medical surgical, trauma and ICU settings, as well as a labor and delivery simulation lab, equipped with ultrasound and mother and baby simulation mannequins. We also have exam rooms, which replicate an office or clinic setting. Here, students learn the techniques of performing a full physical exam on each other and with actors. Paid actors, often students from our College of Communication and the Arts, play patients. They're given a script and a medical scenario, like a sports injury or speech problem. Actors have a separate area to prepare, review their medical symptoms, and enter the exam room to wait for their care provider. Before entering the patient exam room, students are able to review the patient's electronic medical records on a digital screen. Here, there's also a control room where actors are fed lines and additional details about their medical conditions and needs, allowing real-time responsiveness from the care provider. Debrief rooms for video viewing and faculty-led group discussions allow students to deconstruct and evaluate the simulation session. We also have the skills labs, where students learn all of the skills that are necessary to care for patients, such as performing evaluation of vital signs, dressing changes, medication administration, and therapeutic communication. Skills labs are an important cornerstone that helps students build the core skills needed for professional practice in clinical placements. These simulation labs are where students practice things like suctioning, suturing, changing dressings, drawing blood, and physical assessment skills like monitoring blood pressure and heart rate. We also have a lab dedicated to pediatrics, so students learn the skills they need to work with younger patients. The IHS campus offers state-of-the-art rehabilitation learning facilities. This includes a world-class activities of daily living lab. This trains students who make home visits to assess the environment and make recommendations. especially to occupational therapists who use the ADL lab to learn how to re-assimilate patients to their homes and normal lives. Mastering routine tasks like cooking, doing laundry, bathing, and other simple daily tasks patients struggle with after injuries. Our state-of-the-art rehabilitation gym is the perfect environment to train physical therapists and athletic trainers how to rehabilitate patients after an injury or surgery. These facilities help students practice the skills they must develop to rebuild their patients' strength and stability. We also have exercise physiology and therapeutic exercise labs, as well as intervention labs and human movement labs. We also have a state-of-the-art motion gait lab to research and learn to improve patient mobility and ability. Our exercise physiology lab is a hub of research to advance the understanding of how exercise affects disease progression. Together, these research and rehabilitation labs provide our health profession students with a comprehensive learning environment to practice their skills. Our gross anatomy lab has refrigeration for 40 cadavers and tables for 20 cadavers to be dissected at once. Locker rooms are set up right outside the gross anatomy labs for ease of changing before and after your time in the lab. This is Seton Hall's Interprofessional Health Sciences campus, leading the way for the future of healthcare.